Now the council will sit as the Board of Health. This morning we have Dr. Bridgers, Dr. Kroll, and Dr. Stoddard who are joining us. Dr. Bridgers is going to have to jump off for a short while, but we're hoping may be able to jump back on. I want to announce publicly that our colleagues in Montgomery County Public Schools are not participating in today's Board of Health session. But we knew that in advance. They are meeting as we speak at the same time with the Board of Education to discuss their recommended operating budget for the upcoming fiscal year. That has a firm deadline, and as we all know, they have a very large budget, and so we respect that our colleagues in MCPS are conducting their business, but we do look forward to having them participate on our January 18th session to discuss the myriad of issues that were talked about in a town hall hosted by our colleague Councilmember Hucker on Sunday afternoon, which had over 3,000 participants and just further underscored the emotion and the frustrations that are being experienced by many right now for very understandable reasons. So with that, I will turn it over to our Department of Health and Human Services team to give their presentation with an update of the numbers, the situation on the ground. And this morning, we will also be discussing the introduction of the vaccine passport. We have issued a series of questions to the executive branch, and so there will be a discussion regarding that item this morning as well, which we will bring back up again next week when we will hear from some of the key stakeholders who will be the most charged with carrying out that order. So with that, we turn it over to the HHS team.
So good morning. I just wanted to weigh in just a little bit, Council President Albornoz, before Dr. Bridgers and Sean O'Donnell do the COVID report, just to acknowledge that the tragic fire that took place this past weekend over at Long Branch, and to thank Council Member Hucker for his message regarding the support that the work that the team did over the weekend to try to make sure that these 56 individuals and those households were supported and sheltered and got to safety, and the work continues with them to get them in place, to get them taken care of. The team did a phenomenal job, and now is partnering with the community to make sure that those folks that their lives are back on track as quickly as possible. So I very much want to appreciate that and acknowledge the moment and the work that they have done. So thank you for that brief interlude. Now turn it over to Dr. Bridgers for the updates.
Good morning, Council President Albornoz and the Council sitting as the Board of Health. Thank you, Dr. Kroll. Just a couple of updates before I turn it over to Mr. O'Donnell for his post report regarding our case data, hospitalization, and some other key metrics that we continue to track on a daily basis. From my conversations with the Maryland Department of Health, there's been a lot of interest regarding the COVID-19 daily report. And so in my discussions with Secretary Schrader and Deputy Secretary Chan over the weekend, those reports will resume this week. I don't know exactly what day, but those reports had a treasure trove of data that we use to compare not only our county level data, but state level metrics, as well as the Centers for Disease Control and Prevention. And so those reports are forthcoming. The Maryland Department of Health Information Technology team has been systematically going through those reports to ensure that any of the challenges that they experienced during their cyber attack were addressed, and so that will be a great return of data. Speaking of data, we've had conversations with our hospital systems. We're going to resume conversations with them on a weekly basis, looking at hospitalization data more closely, looking at staff to patient ratio, ICU and acute care bed usage, and resuming or increasing support for their staff testing using CDC's current guidance. We will continue to work with them and continue to support them and look at other metrics as we manage the Omicron surge. The Omicron variant has been resulted by the Johns Hopkins University Hospital, and 95.5% of those results were the Omicron variant. We're also monitoring influenza-like illnesses in our emergency department and our urgent care settings. We know that in data that we reviewed over the weekend, identified illnesses with influenza and the coronavirus known as flurona. And so we made a concerted effort at the beginning of flu season to get our countyans vaccinated. Thank you to those who continue to get their flu vaccines based on the data from my EPI team that I received this morning. Montgomery County's vaccination rate is at 35.9% versus the state of Maryland, which is at 30%. So we continue to lead the state in getting folks vaccinated, and we continue to work with our hospital systems to identify those flurona type illnesses. The last piece is that we're continue to look at additional symptomatic data and outbreak data from community level spread versus other systems related spread, such as school related outbreaks. I'll stop there and turn it over to Mr. O'Donnell to run through the pulse report and provide metrics regarding our hospitalization rates, case counts, and distribution and vaccination rates.
Thank you, Dr. Bridgers. Just ask someone to confirm that they can see the report. Okay. So going through, we know we've been tracking along with this disease as we go through this wave of increased cases, increased positivity. At this point, we are at a 25% positivity rate for testing that's being done in Montgomery County. We're a little bit lower than the state level, and that positivity rate has come down a little bit over the last few days. We'll see if that is a sustained decrease or not, but it has been essentially around the 25% range for several days now after very steep increases each day. This is a 7-day rate, so it hopefully does not fluctuate as much day to day. Looking at our case rates, we are doing a really massive amount of testing throughout the county. The CDC reports around 80,000 tests have been done across the county over the last 7 days. We are finding lots of cases with high positivity rates and lots of testing. We are now at more than 2,000 cases per 100,000 over the past 7 days in our county, and that transmission rate has continued to climb. Looking at the rate of hospital bed usage, we are at high utilization within the county for COVID patients within our hospitals at 34% utilization. And one thing of note is that not every person who's at the hospital is there primarily for COVID, but they may also have a COVID diagnosis, and that's because our hospitals are doing COVID testing for all inpatients. So we may see a higher percentage here. Recent reports out of the New York City healthcare system is that they are finding as many as 40% of patients who have COVID in the hospitals were not there primarily for COVID. We're looking into this with our own hospitals, but it's worth noting that even if a patient is not at the hospital primarily for COVID, having a highly infectious disease in a hospital setting utilizes a lot more resources when it comes to isolation, and a diagnosis of COVID can complicate lots of other health issues. Looking at the total ICU and acute beds occupied by COVID-19 patients, again, this number has been going up. We're at 509 total patients across all of our acute care settings. And that includes 363 in acute care beds at our primary hospitals, 71 in the ICU across hospitals and the alternate care site, and 75 patients at the alternate care site in Tacoma Park. One of the questions that has come up is how Montgomery County's severe illness compares to other jurisdictions in light of our high vaccination rates. We have been tracking along. As we said, there are people who are at hospitals, not primarily for COVID, so that makes tracking just hospitalizations with COVID diagnoses challenging to say that, because there are still some elective procedures happening in hospitals. It's challenging to say that our hospitalization rate of COVID patients strictly tells a story. However, the death rates we've seen, while increasing notably in December and in the early part of January, we are still a much smaller percentage of COVID-related deaths compared to our representation across the entire population of the state. We'll continue to track these, but as you can see from the data across the state, from November to December, deaths from COVID went from 309 to 549, and already in January, we're at 447 across the state. So it's certainly concerning, and this is data that typically will trail case identification and hospitalization by several weeks. So, this is something we're still tracking on. Looking at our vaccination rates, this is, of course, from the last week's Pulse report. We should have updated information by tomorrow, but our numbers are continuing to go up incrementally. We are at, I believe, 83.5% of the total population now who are fully vaccinated, and our booster levels continue to increase with turnout. We have resumed the data feeds in from the state, giving us a better idea of total vaccinations across all populations. We continue to track on the geographic location of places in our county where we have lower vaccination rates, as well as the vaccine uptake by race and ethnicity. And with the November eligibility for our 5 to 11-year-olds, we've seen these first dose rates begin to climb again, but we've also seen a little bit of disparity happening amongst who is coming out to get vaccines. One thing of note is, I'm going to go back one slide here. In talking about our 5 to 11, we are in the mid to upper 50% range for first doses, and at this point, likely past 40% for second, for fully vaccinated. But the turnout has slowed considerably for those clinics. We've continued to do clinics. We did them over the weekend at MCPS sites. We had handfuls of new individuals in this age range come out for vaccines, but it has slowed quite a bit. And we're strongly encouraging parents who have not yet gotten their children who are 5 to 11 vaccinated to please bring them out, so we can continue to protect our school-age kids and be able to offer school and other safe places with a high vaccinated population. The vaccination rates, particularly within 5 to 11, here we use 5 to 14 as a proxy because of how the data is reported. But we see that it is generally well spread out across the county. We have a couple specific zip codes with lower vaccine rates for that age group. And we have focused doing clinics within those zip codes. We do have daily clinics within the Germantown location, and we've identified locations to do additional vaccination clinics for kids in the East Olney area. We are starting to make up some ground on the disparities within our ethnic and racial communities that were at lower vaccination rates. Those numbers are starting to climb back towards the population representative sampling. And this is something we've seen with other age groups as we've gone through them. It has taken longer to get some of our populations vaccinated, but they do eventually come out. As has been mentioned, the testing volume has gone up quite a bit across the county. These are numbers specific to our county-run sites. And you can see testing includes, in our totals here, not just the public county sites, but also other places we do testing, including municipal partners, government agencies, and some of our other sites like shelters and congregate living. This doesn't necessarily include all the rapid tests at this time, but we're working on including that as well, because that's making up a significant proportion of testing going forward. Looking at it graphically, I can add on to this time frame to say that from the 3rd through the 9th, we did at just the HHS large sites an additional 9,445 tests. That was about a 35% decrease from the previous week. Some of that has to do with we did need to stand down one site for 2 days because of limited staff because of COVID. We also had, of course, severe weather multiple days, which really impacted the turnout for testing. Additionally, I think we saw a really high rate of testing right around the holidays as people returned from travel. And again, I just wanted to mention that the CDC's reports are that Montgomery County had 80,818 tests performed over the last 7 days, which is a significant increase from previous reports. And as far as rapid testing goes, we continue to work with a number of different manufacturers to obtain rapid tests. We've made a significant amount of headway in this. We do continue to distribute tests out to some of the higher impact populations who have had a higher impact from COVID, as well as those that continue to represent greater risk because of the congregate settings they work in or live in. So we continue to distribute out to those, including adult daycare facilities this past week. Additionally, more than 2,144,000 rapid tests have been ordered from vendors. A total of 588,000 have already been received. Of that, 190,000 have been provided to MCPS as part of their testing their populations with return to school. And as of yesterday, our first day distributing through our library partners, over 93,000 rapid tests were distributed. And this was a phenomenal success of our librarians who volunteered to work at these test distribution sites, as well as our Medical Reserve Corps partners who worked with them. And of course, our county agencies who provide a tremendous amount of support behind the scenes, including our Department of General Services, who made sure that all these sites were supplied throughout the day. So that I believe Dr. Starter may have some additional comments on this. We'll continue distributing rapid tests through our at-risk communities, and we have stood up an online portal for the public to report their rapid tests, whether they come from us or somebody else. That is now part of our testing website. You can go on and report your tests through that. I would just caution the public that at the incredibly high number of positives that are being identified throughout the day, we are prioritizing the individuals that we can reach out to and make contact with for contact tracing. It's clearly not going to be every person who has a positive, but we are likely focusing on those who are in congregate settings or high risk to other people who are around them. So we'll have more information on that going forward, but Again, we're identifying lots of people in the community who are positive, which is good. And at this point, most of the folks in our community know what a positive diagnosis of COVID means. It means you should isolate for the period of time until you recover and are no longer infectious. That's the update from public health right now, and happy to turn it over to Dr. Stoddard if he has additional information he'd like to add.
Thank you, Mr. O'Donnell. I appreciate it. A few things I want to comment on. A couple things that Sean already alluded to. So first, for the rapid kit distribution, well, let's start with the reporting portal. So we are going to have the portal is actually being translated into Spanish at today. So we'll put out a press release describing the portal, both English and Spanish, going out hopefully later today once the Spanish translation for the portal is complete. But obviously it is up and running in English and the back end works and all that stuff. And we wanted to make sure that was the case. But obviously we'll have to translate and put out information to the public about utilizing that portal. As far as the rapid kit distribution at the libraries go, it was a phenomenal success. I want to join Mr. O'Donnell in thanking all the partners who were involved in it, particularly the libraries and library staff, as well as the volunteers who did the distribution. I know several of you on the council did participate yesterday, and we appreciate that as well. That said, obviously 93,000 is a big number. It's a great number. We're very happy with the distribution, but we don't have a supply to sustain 93,000 rapid kits a day for the 6 days a week that we will be doing that distribution, considering the other partners that we do have to support. So beginning today, we will be limiting each site to between 1,800 and 2,500 kits per site. That will be about 35,000 kits across the county per day compared to the nearly 94,000 that we did yesterday. But that will allow us to sustain the effort through the rest of the week, including Saturday. We are hopeful that we'll get another delivery later in the week, and we may be able to up those totals as we do, but I want to make sure that we can commit to keeping the site open for these shifts and days that we've already advertised and made public. In addition, we will be providing additional kits to the public school system, our private school partners, childcare providers, and a number of the community partners that Mr. O'Donnell already alluded to, as well as we've opened up a process for our municipal partners to request specific allocations, and we are working with them. We know, for example, with the Poolsville Library currently closed, we need to have a site up in Poolsville, and we're working on that actively. So I wanted to make sure that was clear. One other thing that Mr. O'Donnell alluded to, and I think that is important in the data, is about the booster shot. So one thing that was clear in that data, I think we talked about, we were around 50% or 45 to 50% last week, and now we're between 40 and 45. There is an increase in the number of people coming in for boosters, but that's being in some cases outpaced by the number of people who are becoming eligible for boosters. And so obviously with the addition of the 12 plus population being eligible for boosters, there's now a greater population who is eligible. And it's, the people coming in is being currently outpaced by the increase in eligibility. And so we have a large population of people in Montgomery County who need to be boosted. And I do think that is significantly contributing to the hospitalization rate we are seeing in the county and generally to the infection rate. While boosters are not necessarily a full protection against infection, they will reduce your opportunities. And the hospitalization data is stark. 2 doses of the mRNA vaccines, Moderna and Pfizer, or 1 dose of the Johnson & Johnson are insufficient to prevent, hospitalization, at least in patients. There are many cases of hospitalized, not necessarily as severely. I think that's key. It's degrees of protection. So being quote unquote 2-dose or fully vaccinated, which that definition certainly CDC is currently in the process of changing, I suspect. Having 2 doses is a level of protection. It is likely not a sufficient level of protection for Omicron and what we're seeing right now, particularly if you're more than 6 months since your last vaccination. The last thing I wanted to comment on was we talked a few weeks ago about the impacts of the fire service of staffing. This is generally shared amongst several of the other agencies across county governments, and that's transportation, police, corrections. A number of county agencies are experiencing issues. I will say that we are starting to see, at least in the fire service, that data shift. And I will share my screen briefly to show you the staffing availability data from fire rescue that was shared with me this morning from Chief Goldstein. And I think you can see my screen now. This is sort of shows you over time, day by day, staffing and availability that peaked on January 3rd with more than 160, nearly 170 personnel out from the fire service. And as of today, you can see that downward trend. We're down to just over 80 as of today who are out. So while this isn't a perfect situation, obviously there's just still 80 people who are unavailable to us. It is obviously substantially better than we were at even a little over a week ago. So that shows that maybe we're seeing I think we saw the alignment of the holiday period and the Omicron surge, and maybe we're seeing obviously the holidays are over. We're coming out of that. Omicron's still here and still will be with us for a while, but maybe in terms of staffing and availability, we may not see as bad as we did during the period of the holidays. And so that's all I wanted to show. So I think with that, I am finished with my comments. I don't know if there are additional comments from anyone else on the team, but I think we could take questions.
Great. Well, thank you all for the presentation. I do want to publicly acknowledge and thank the team for all of your efforts to initiate the rapid test distribution yesterday. I personally was not able to make it out because I wasn't feeling great, but it sounds like by all accounts it was a significant success, and I've heard from my colleagues that were there that they received very positive feedback from constituents. So thank you so much to everybody that made that possible. We have a number of my colleagues who'd like to speak, and once again I remind everyone after the Q&A regarding the presentation we just received, we will then formally introduce the public health order at the request of the county executive, and I ask that my colleagues in the executive branch stay on for a conversation regarding that introduction to get some background and context, and we'll go from there. So on the speakers list, I've got Councilmember Rice first, followed by Councilmember Reamer, then Councilmember Hucker, and then Council Vice President Klass. So Councilmember Rice.
Well, thank you very much, Mr. President. It's going to be hard. So my work family knows that my mother unfortunately suffered a heart attack and was hospitalized on Saturday. And fortunately, because of the great care of our hospital system, she's doing well now. She's stable, but it was incredibly scary. And I want to share with folks why vaccinations are so important. Because the hospital that she was first sent to, Holy Cross in Germantown, was overwhelmed. And as I talked with the hospital staff there were so many things that they were trying to do to handle the critically ill, like my mother, in addition to those unvaccinated, majority, who had COVID. And I talked to many of the doctors and nurses throughout the day as I sat there in a waiting room. And I also talked to family members of people who were unvaccinated. And the same stress and fear and worry that I had for my mom was the same exact thing that they were experiencing. So I have a personal plea to all those who are unvaccinated who think that, I can handle this on my own. The reality is that think about someone else besides just yourself. Think about your family and friends and how they're going to sit there in that waiting room and hope and pray that you make it, that you live. Because that's what I was doing for my mother. And I was also concerned about the fact of how they were both competing for the same space. And so there's so many critically ill patients that will go into our hospitals who will need that space also. And so we don't want to take up those spaces with people who can actually prevent being in the hospital in the first place. So I beg of you, please, if you're not doing it for yourself, do understand that there are other people out there who are going to have issues that are going to need to use that hospital space. If you can't do it for yourself, do it for them. And if you can't do it for them, do it for your family and friends who are also going to be sitting there in the waiting room, praying in prayer circles, talking about the memories that they have of you, hoping that they'll still have additional memories of you, that they'll be able to live with you and make. Because I talked with those families. As I sat in the hospital for 2 days, we all start to talk to each other about what's going on. And I talked to families of those who had done everything they possibly could to try and encourage their family members to get vaccinated, and they refused. And now here they are fighting for their lives. And if you don't do it for them, then please do it for our hospital workers, our doctors and nurses. Because as I found out about my mother and was in the hospital with her, I found out that my mother-in-law, who is a nurse at Holy Cross Silver Spring, contracted COVID and had COVID and pneumonia, who was also vaccinated and boosted. So even though she was vaccinated and boosted, she still got COVID and had it seriously enough so that she actually developed pneumonia. And fortunately, she is also now stable. However, I say to you, our healthcare workers on the front line are fighting each and every day to protect and care for those of you that are sick. And they're putting themselves and their lives on the line. I've talked about this before, about how my mother-in-law, along with all of our healthcare workers, has always been on the front lines, caring for those as we set up the tents when we first found out about COVID and had the tent set up outside. She was out there testing people, trying to make sure that people were safe. She was caring for people who she didn't know, because that's what she said that she was going to do. And so many doctors and other nursing professionals and staff that are in these hospitals are doing the same exact thing. So I ask you, if not for you, do it for the people that would be sacrificing themselves for you. It's not too much to ask. It's not. And so I really want to just say thank you to all of the professionals that cared for my mother and my mother-in-law. It was an incredibly traumatic weekend for me, but one that was eye-opening as to exactly why we need to make sure that we continue to press for vaccinations. The unvaccinated are 9 times more likely to enter our hospital system, and those beds and those resources are precious. Keep in mind, it's not just about the beds. The time that they spend, the nurses told me, the time that they spend with a patient that's unvaccinated and the procedures that they have to go through because they know that now this person is COVID positive requires more time and more effort to try and ensure that they themselves don't get sick. And those precious time and resources are ones that are then diverted from other patients who also need that attention. This is real. I've seen it at 2 hospitals, at Holy Cross in Germantown and at Washington Adventist. And all of the stories are the same. We can change this by making sure that we continue to push for vaccinations for everyone. Set aside your political debates. Let's do this for us as people, as a society. Thank you, Mr. President.
Councilmember Rice, I know I'm joined by all of my colleagues in expressing our deep appreciation of you and your family. We're so happy that things are turning out for the better. And that message was so important and so authentic and something we all need to be hearing right now. So thank you so much, Councilmember Rice, for your leadership and for the blessing of your family as well. So colleagues, I wanted, Councilmember Rice signed up to go first, but I was going to give him a longer runway anyways to share that personal story, which is so important, especially that since it occurred this weekend. I do ask the rest of my colleagues to limit your comments to 5 minutes. If you want to get back in the queue in the end, that's okay. But we still have to get to the vaccine passport discussion, and we have the rest of general business and a lot of other stuff to get to this morning. So with that, I now turn it over to Councilmember Reamer.
Thank you. Councilmember Rice, thank you for your powerful comments. You know, my mother had a heart condition earlier in the pandemic, and we were just so fortunate that she was able to get access to care. It was not during one of the peak surges, and had it been, she had a condition where she needed rapid treatment, a surgery, and that's the real cost that the unvaccinated are bringing is, overwhelming health systems. And then folks who get into a car crash or have a health condition that needs treatment are finding it harder. And our hospital system is not just filled with Montgomery County residents. We're experiencing the overrun of unvaccinated Marylanders who are from other counties who are being placed in our hospital system.
So even though we are so diligent here about following the best practices and getting vaccinated and increasingly getting boosted, there is still a consequence to us from those everywhere who are refusing. And I think Councilmember Rice's appeal to do it for others hopefully is heard. I thought that today's New York Times, David Leonhardt, shared some very powerful information about the divergence between the vaccinated and the unvaccinated in terms of their hospitalization rates and their death rates in two cities that have provided reasonably good data, New York and Seattle. And it's just so striking, the massive gap between the health outcomes of individuals who've been vaccinated and those who've not. And that's really continues to be the urgent priority. And my concern at this point is I think we've lost our footing with the medical guidance. And I think that we're having conversations without the benefit of expert voices from organizations like the American Academy of Pediatrics and the children's hospitals. And we're simply listening to one another as residents or even as elected officials, at large in the community. And we have got to return this conversation to the health and scientific guidance of those who have access to the data and who understand, the health science. So I think there's far more reassuring information for our community about the risk level that you face once you're vaccinated. Should be assuring and calming. And I think we're having trouble getting through with that in the midst of this COVID hurricane, which is just blowing outside. And so I do want to ask, along those lines, I am a big fan of Dr. Bridgers. You're doing a great job. But I wanted to find out, where are we on hiring a new chief medical officer, understanding, Dr. Bridgers, just for certain reasons, is not eligible to be that person. And I think we need more expertise and capacity at the table. We need more knowledgeable guidance and health and scientific leaders sitting there to help guide our schools, to help guide our county. So we have been months now without a replacement for Dr. Gales. And where are we in the process of hiring a new chief health officer, chief medical officer?
Councilmember Raymer, good morning. Thank you for the question and for your comments. And just want to also say thank you, Councilmember Rice, for your candor and your sharing your story and the experience of those folks who are in the waiting rooms with you seeking help in this moment. We are, in fact, we are interviewing for health officer candidates for health officer position this week. We did a first round before the holidays, and the candidate that we thought was going to be the candidate we might have put forward made a decision. One of the candidates, made a decision to decline and go and do something different with their lives at this point. So we are still in the search for a candidate. Obviously, we're wanting to find as quickly as we can the best candidate that we can for the job, and the most qualified candidate that meets the needs of Montgomery County. I do want to assure the public that we have an acting health officer, Dr. Bridges, who has the expertise and the experience to continue to do this work, but he does not do it alone. We continue to have consultation from the health officer from Prince George's County where we need it, and a panel, an advisory panel that Dr. Gales put in place that is still active in supporting the effort. So it is not a one-person operation. It continues to be an entire team of folks that are making good decisions and offering good guidance and good advice to Dr. Bridgers and to the public health team in responding to this pandemic.
Thank you. And I truly mean, my comment is not in any way an aspersion on Dr. Bridgers, who I think is marvelous. It's just that, we need a chief health officer at the table. And I am concerned about the guidance that has been provided. I think one of the chaotic elements of the January school process has been the guidance provided to MCPS and their response to that guidance. And I think having a a chief health officer at the table would help smooth this out, provide more certain and I think stronger guidance to help us through. So please keep us posted. It's obviously urgent that we hire this position and try to recenter this conversation in health and data and science. Thank you so much.
Thank you, Councilmember Reamer. Next, we've got Councilmember Hucker, followed by Council Vice President Glass. Then we will hear from Councilmember Friedson, Councilmember Katz, followed by Councilmember Navarro. Councilmember Hucker.
Thank you so much. Thank you so much, Council President, and all of you for being here. I want to acknowledge and thank you again to Councilmember Rice for sharing that really important experience that we all wish you weren't going through. I want to thank Dr. Kroll for his mention of the fire at Long Branch too, and the call from Dr. Stoddard that I got that morning, and all the great work of HHS and OEMHS that I saw firsthand this weekend. Patrick Campbell and Marianne Soders did a great job taking care of those residents. I'm glad they were put in a hotel. I hope we can continue to look for one in Silver Spring, closer to their work and their families. I have some options for you, but they were definitely, the team performed very well Saturday morning. And thanks to the council president and several colleagues for attending the community meeting we put together on Sunday. Yeah, it's unbelievable. We had, in fact, it turns out over 5,000 attendees on 24 hours notice, and many more who watched the video. So there's an unbelievable amount of concern and anxiety out there about the pandemic and its effect on our schools and our students and our staff that I just haven't seen before. One thing that came up is our questions about decision making. Can you tell me how often HHS meets with the Board of Education to discuss COVID safety guidelines in our schools, and whether those meetings are with the whole board or the leadership of the board?
So, Councilmember Hooker, I can't tell you exactly how often we meet with the board. We do meet with the board periodically to share with them our guidance and our thinking about the pandemic, and to give them whatever counsel they are asking for. We are meeting with the administration of the MCPS on a regular basis to make decisions and to try to figure out what the process is going to be for how we keep our students as safe as possible and align with the decision to keep schools open.
Thanks. Could you tell us a little more about what periodically means? I did talk to several board members who feel like they'd say sort of in the dark at times, and I'm sure they're grateful for your meetings with the superintendent and the leadership, staff leadership, but the public certainly, I think, has an expectation that the board members are making decisions as well and consulted. So it is periodically, like once every few months or once every week? How does that work?
I can't tell you the last time we met with them. I believe it was a week or so ago.
Okay.
So it is when they are convening and wanting to discuss this with us and asking us to be there. If we're here, we're not there, obviously. So we might have been invited to this morning's meeting, but not been able to make it. But we are meeting daily with the administration and conveying messages to them, and have confidence that they are sharing our guidance and recommendations to the board.
I see. Okay.
But we've never been invited to a meeting that we did not attend. So I think that's clear. So any meeting they want us to come to, we'll have HHS representatives all in that meeting with the Board of Education.
All right. Well, that's definitely clear. Thank you. Which I'm sure I'm probably not the only one of us who'd like to sort of catch up on that process. So if you wouldn't mind sharing like the minutes from those meetings, I'm sure you're documenting it also. Just be nice to know sort of how decisions have been made, so we can answer the questions from, we're drowning in questions from constituents on this. Could you
I don't know that we document the minutes of a meeting for the board necessarily, of the school, of our meeting with the Board of Health.
No, you probably wouldn't the board? So I should ask the board.
The Board of Education may document, so you'd have to ask the Board of Education for those.
Okay, I can ask them. Thank you. Could you explain just more about how the decision tree that you use with the MCPS about how safety decisions are made?
So happy to talk about that. We are looking continuously, and this, I know that there's been a lot of controversy and a lot of discussion about the last several weeks, but we're constantly looking at what we're seeing in terms of school positivity rates, the rates at which we're seeing infection, the numbers of students that need to be contact traced, et cetera, from our side of the table. We're also looking at what's happening with the staff and whether or not they're being infected and whether or not there is that poses hazards and threats to the school. So and we're also looking now at adding an additional set of we're also I've been looking at, but adding to that discussion a look at what's happening in the county in the regions as in relation to what's happening in the schools in terms of rates.
Okay, thanks. So a speed round because I'm running out of time. Can you begin testing on site at schools now that we have enough test kits for staff and students who request it?
So yes, the plan now is in the face of Omicron, and it is to bring rapid testing. Dr. Stoddard mentioned that we distributed 190,000 tests to the school system. The plan now is to send those tests. The school is now sending those tests out and asking folks to respond back with the results of that. So we get a clearer and sharper sense. We're continuing to test in the schools for symptomatic students and identifying positives and close contacts. So we're back in that flow.
I strongly think we should, as quickly as possible, move to requiring a negative test to attend school, like DC and Baltimore are doing. And how soon will you? I'm glad that Google Form is being translated into Spanish. How soon will you translate it into the other languages that our families use?
So I'll have to check back with the team on how quickly they can get those translations up, absolutely as fast as we can, obviously. You should know that the school has a portal that they have been reporting, that people have been reporting. Right. We will use their portal, and we'll have some conversations with Mr. O'Donnell about how we link those two portals together to eliminate confusion.
Right. I understand that that's still just in those two languages, so that's probably why a lot of our schools that are the highest poverty and have the most language diversity are reporting the fewest cases, which is probably not accurate. But
it's one of the reasons we went to 190,000 tests to distribute tests across the entire system, is try to get a sense from everyone what sure. But if they can't report on the form, then you are not going to get the data we need, right? I mean, I know you know that. Thank you so much. Sure. Thank you, Council President.
Thank you, Councilmember Hucker. Council Vice President Glass.
Thank you, Mr. President. Good morning, everybody. I first want to applaud libraries and DHHS and all of county government for the very orderly distribution of the tests yesterday. I stopped by the Wheaton Library and Rec Center and saw the line wrap around the building. And then when I went inside to help distribute tests, it was working smoothly, efficiently. And I also want to applaud our residents for being courteous, not only to each other, but to county staff. The line again and the people, it was a pleasant experience from my perspective. And I know the volunteers and the staff that were there also did not exhibit any problems, at least at the Wheaton Library. I know that from what I've seen on social media and text, there were some problems with people finding parking or some traffic situations at various locations. And I would strongly urge people to maybe park a block or two away if they're able to do so, understanding that not everybody has the ability to walk and then stand outside. But if you are able-bodied, walk a block or two and spare yourself some of the parking headache that might exist in some of those locations. But again, my hat's off to everybody who is helping to do this. I've also received some correspondence from residents in the western part of the county, particularly Poolesville, whose library is undergoing renovation, and they are wondering if there's going to be special accommodation for them to be able to receive some testing.
Short answer is yes. We flagged Poolesville as an area of need. We've been working with the commissioners from Poolesville to identify an appropriate location and mechanism. So yes, Poolesville, we're going to have additional locations. Actually, we're going to have some additional things to announce over the coming days, but Poolesville will be among those places we identified, yes.
Excellent. Stay tuned, Poolesville. And then also, I know that there was a slide I think Dr. Bridgers had shown during the presentation about all the different agencies and social service agencies and others that are going to be able to receive some of the tests of the more than 2 million that the county has at least ordered. I'm curious about the partnership or collaboration with some of the social service agencies, and I've also gotten inquiries from some independent schools about where they might be in this queue.
So we've got certainly So the community groups we're dealing with on an individual basis. So we've been doing, actually, the community groups have been getting kits for longer than most. So if they're interested, they can certainly reach out to us and we'll add them to the group of people that we're providing kits to. Obviously, we're getting a large number of kits. They're not all here yet. So we're trying to figure out how in the actual what we have on the ground now, we can distribute that best, recognizing that there's 1.5 million more or so coming. So we're going to have a lot more to deal with. So we're going to provide community groups. If they want to reach out to us, we can certainly add them to the group of people. We'll figure out what the best distribution is, make sure we're spreading across the county as best we can. Now, on the independent schools, we've already received 20 or so schools have reached out directly. And so we are going to start providing those as well, just as we are for MCPS. Just, again, the requests outpace the current supply, and so we're trying to balance what we give out to the libraries. We're making sure that all these other mechanisms are being met so that we can get as broadly available within the community as possible. So if the independent schools want to reach out as well, happy to receive those. I'm going to tell you right now, not all orders will be met week one. That just will not happen. But we are certainly going to spread this out, and the private schools are a group that we've already flagged. Mr. O'Donnell and I met yesterday to discuss this. They're already a group that's going to have a portion allotted to them, and then we'll divvy up from there.
Excellent. Welcome news. And I will encourage folks to contact you if they want to get into that queue. Just switching gears, I also want to extend my own sympathy to Councilmember Rice for what he and his family are going through right now. And last week, the governor said that he was, employing, National Guard to help with the crisis that is in our hospitals. And I am curious to know, what the state of our own healthcare facilities are here, aside from the anecdotal stories that we're hearing. Do we know if any of the National Guard are going to be deployed to any of our healthcare systems? And then, quite frankly, number of folks I've been speaking with are curious whether or not the National Guard can be used for other needs, whether it's school bus drivers, whether it is ride-on drivers, understanding commercial driver's license issues there, but just trying to see what flexibility and what the need might be with the National Guard.
So we did file a request for the National Guard to support Montgomery County Public Schools transportation. That request is still pending. They're still looking around. My understanding is the National Guard may not be able to help, but they've also sent it around to counties around who, may be able to help us with additional. We've looked also through our emergency management group internally at county employees and partner agencies who may have them. So I don't have anything to report on that front in terms of needs being met, but we've made the request formally for the Guard and gone through the process with the state of Maryland to do that. So that was something that MCPS requested of us, and we sent it up. So we are trying to help them to the maximum extent that we can. But obviously, CDL drivers were a problem before. CDL drivers with a background check so that they can, supervise students while they're on the bus. Also a challenge, but we are actively working on that problem with them.
Very good. Making the request is the first step in the process.
Yes, right.
And we can always appeal to the governor, as we have over the last 2 years, to get things that residents of Montgomery County need. And so I appreciate the initiative there. I see my time is up, and I will yield back to the president. Thank you very much.
Thank you, Council Vice President Glass. We've got Councilmember Friedson, followed by Councilmember Katz, then Councilmember Navarro, and then Councilmember Jawando. Councilmember Friedson.
Thank you, Council President. Thank you to the health team. I just first 93,645 rapid tests is a staggering number. And so I just wanted to thank the health team, the libraries team, and everybody else who was involved in that effort. It's not an easy undertaking, obviously, and certainly there's a lot more work to be done, but thank you for that. You see the need, and you see the tremendous anxiety that is in the community, and so meeting that need is going to continue to be a challenge, but I appreciate that yesterday was a really important first step to that. We also see that our residents step up and do the right thing when they're asked to, and that has been the case throughout this pandemic. It was the case yesterday. We said we have available tests. We want you to show up and get those tests and use them when and as they're needed, and we want you to be courteous and respectful as you do it. And overwhelmingly, residents stepped up to do that yesterday, and I know and trust that they will continue to step up to do that as we move forward. Appreciate the specific work on the Poolsville site. That is a big need in Western Montgomery County that in so many other ways lacks adequate access to health and public services. And so appreciate the work there. And also in Friendship Heights that has a disproportionate elderly population that are at particular risk during Omicron. Just wanted to get a sense, I know you're working on it, but if there was any idea of potential timing for when those could potentially be online for residents to actually benefit from them, and then what the communication would be. Are the municipalities going to be communicating? Is the county going to be communicating? Will it be a combination to do the outreach?
It will be a combination, and I know I received, for example, I received the formal request from Mr. Mansfield on exactly how they were going to do it through Friendship Heights this morning, and I believe that Mr. Eck from Poolsville Commissioner had reached out with their distribution plan this morning. So we'll review those this morning. I think that they both propose Friday start dates, but I'll let they'll be part of the announcement. We'll support their announcement with that, but obviously we will work through getting them the kits that they need to allow that to happen. So it looks like both Poolsville and Friendship Heights have requested to start on Friday. We'll get them a number of kits to do that with, and then we'll let them start to push that announcement out. But what we've said is, and I think we'll make this clear, while the municipalities they're going to help us support this, and that's great. They'll be able to offer particular nuanced opportunities for their participants, and they're allowed to message in whatever way they think is appropriate. We also don't want to see people turned away who are county residents at sites that are administered by the county. So we're trying to balance those things out, giving maybe a opportunity for them to message more specifically to Poolsville, for example, so that you don't have that site being overrun in the way that other sites have been overrun from across the county. So we want to make sure they have a special opportunity, given that they have been, as you said, fair access has been an issue in Poolsville, certainly one that the county executive has recognized, and I know you've been very supportive of as well. So,
well, appreciate your sensitivity to that and your work. If you could share with us once those plans are formalized, and we'd love to help be part of the outreach effort. Certainly the municipal partners are critical here, but there are a lot of other stakeholders that are involved as well, and we could certainly be helpful with that. So please keep us apprised of that. I also appreciate your work now with the independent schools and the child care. Obviously that's something that has come up repeatedly, a major need. And I know the request may not be able to be fulfilled immediately, but any sense of timing and the amount of tests that you would expect for those two areas or organizations?
Yeah, so what's been requested is 80,000 test kits for the child care providers, which is roughly basically a 2 test kits for every provider and child in that we have with the registered child. And that's not all informal, but that was sort of the rough request. Now, my guess is that's going to take multiple weeks of giving it, 25, 30,000 a week, something along those lines. And I will also say for the child care providers, we are also going to be providing them with KN95s to upgrade the face masks that are available to them for child care settings as well. And so that will be done as a combined effort. Miss Netta Squires from Emergency Management is coordinating with Health and Human Services staff to design a program, just as we had done previously with PPE for child care providers, a similar program to begin distribution. Their intention is to begin distributing this week, but obviously it'll be a multi-week process to get all the child care providers in. Now, for the private schools, obviously the requests are still coming in, so we're trying to field them in real time. I think we've allocated approximately 20,000 from our current supply for that to begin that process, and that will be an ongoing process. That's not 20,000 for the entire time, but it's 20,000 from what we know we have on hand. We have more shipments coming, but that's sort of the rough strategy for private schools right now.
Appreciate it. You said earlier, Dr. Stoddard, that the vaccination that we consider to be full, or at least previously considered to be full vaccination, perhaps officially considered to be full vaccination as a terminology, 2 doses of the 2-dose, what were considered previously to be 2-dose vaccines, which I actually believe are 3-dose vaccines at this stage of the pandemic, provides a level of protection, but not a sufficient level of protection, which I think is a good way to describe it. What are we doing to get that word out? Obviously, we can only do so much at the county level, But this is really a 3-dose vaccine. The numbers are overwhelming that you've shared earlier today and that we've seen elsewhere throughout the country, not unique to Montgomery County, that the level of protection that you get for Omicron in particular from 3 doses, it's not really a booster, it's really the 3rd dose, the 3rd necessary dose to have a sufficient level of protection, as you stated. What are we doing? What's our plan with that? Because I do think that that's the most important thing that we can do for our residents, and frankly, as well as we have done to get our residents 83% and climbing, fully, 2 doses and 95% with 1 dose. We're slightly better, but not nearly as good as we would want to be at 40, around 40%, receiving the 3rd dose. What are we doing to significantly and dramatically boost those numbers?
Yeah, so the Office of Public Information has been working with HHS actually to launch a similar campaign to what we did during the early days of vaccinations around boosters, meaning a specific campaign driven around booster uptake that focuses not just on English-speaking populations using media and social media, but also, using those nuanced things that we had great experience with in our diverse communities across the county. And so obviously things like the Salute effort, as well as the AHP, AAHI initiatives will be utilized to do the same things to really try and press upon people the need and importance of boosters. But there's been a specific talk about programming and resources in terms of financial resources put towards a specific effort around encouraging boosters. Now, obviously, I think there are other things that we should talk about. And obviously, we'll be talking about the notion of the passport program later and whether we should potentially include boosters in that program if such a program we considered. There are other things that we can do and other levers that we can utilize to look at that. But certainly, I think what has become increasingly clear over the last certainly 3 weeks, you can have your anecdote, you can have your data, and they both line up to say there are still people who have received 2 doses of the vaccine who are being hospitalized. That is beyond question. About 25, 30%, depending on where you look, of hospitalized patients have the 2 doses. Very, very, very few hospitalized patients who received the booster. There are some, like 2%, I think, in the University of Maryland medical system have received boosters, but compare that to 25, 30% who have 2 doses, and then the remainder are unvaccinated. And so it is clear that getting 2 doses is a great step in the right direction. It is very clear it is not sufficient to prevent hospitalization in a broader swath of people. Now, it may protect against death. I think that's an important thing, and we should recognize that and appreciate that for what it is. But for when we talk about hospital surge, that booster shot is key, and that's the messaging that we're going to be putting out. And we should all be thinking about how we can do additional steps collectively to encourage and or push people in the right direction.
So I would
I see my time is. I'm sorry.
Just to add a piece of that one of the things that has happened last year and is happening now is that when we have these surges, people turn their attention immediately to testing, and all of our voices start talking about testing and getting resources out. It is vital that we collectively message test and vax, and to get vaccinated, because otherwise testing doesn't keep us from getting the dose, getting the virus. It tells us where the virus is and who's contracting it. But if all people are focused on is testing, and all we're focused on is messaging on testing, then they'll go for testing and not go for vaccination. We need to continue to drive forward the message around vaccination to people. We're also looking at doing more integrated testing and vaccination opportunities, so folks can get tested and get vaccinated, and or get first, second, and booster shots all in one form. So as we've gotten past our first effort with pediatrics vaccinations, we're now expanding out to make sure that we've got combined vaccination efforts in play. So,
Dr. Cole, thank you so much. That is specifically what I was getting at. I appreciate the fact that you and Dr. Stoddard and Dr. Bridges are working on it. I see my time is up, and please keep us informed on that and let us know how we can be partners to get that word out, because I do think that this is a communication and an operational effort, and it needs to go hand in glove, and we can be partners on that. So thank you very much.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. Let me just start by saying to my good friend and colleague, Councilmember Rice, I sincerely appreciate, first of all, it was upsetting to hear what your family is going through, and then it went through it a second time. but you know that you're very important to all of us on this council, and especially your own personal family. Your mother especially is I think everybody's mother who has ever met her. So we are all continuing to pray with you. And I want to thank everyone for all the work that's being done on this. This is obviously an unbelievable task that you're doing. And I guess it's to Dr. Stoddard. Are we going to continue to give 2 tests per person who for the rapid test? How is that going to work?
Yeah, that's our intention to still do that, because many people are coming in to pick up on not just behalf of themselves, but their family, or alternatively on behalf of someone who's sick that we don't want coming to the site themselves. And so that's been our mechanism. We're paralleling what the District of Columbia has done. We think there being regional similarities is an important benefit to the people. There's no confusion about when 1, 2, or whatever.
And then I've had the question, when someone picks up 2 tests, are they allowed to come back the next day and pick up another 2 tests?
They're allowed to. We would clearly, if we're talking about, I think people referred, I think Councilmember Glass, or Council Vice President Glass, said earlier that we asked our residents to do something. They stepped up. They were very courteous. We're asking that again. If you need the tests, come get the tests. If you're looking to hoard them in your house, please allow other residents to access the kits as well. And so that's our very clear message. If you need to be tested, you have more family members than you could pick up yesterday, come back out. Of course, no problem. If you're doing it so that you can have a stockpile of 5, 6, 7, 8 kits in your house, please let others get it. We're going to keep getting supplies. You're going to keep distributing. You can come back at a later time when you need the test kits. Don't hoard them.
So I would underscore, yes, we're going to continue. This is not the only round of tests. There will be additional tests available for folks, but also to say to folks to let people know that if you need the test now because you think you've been exposed and you think there's some risk of COVID, you may be symptomatic, that's a point to use the test. If you're not symptomatic and you've maintained some social distance and you've kept yourself safe and secure, you don't necessarily need to get back in line for that right away, and you can wait and let some other folks who might have a more urgent need to access the test first and then come back at a later point.
Thank you. And we do need to be clear. And on that, and I want to publicly thank Councilmember Hucker for the event that he had on Sunday and the unbelievable turnout. But I think if we had to underline what was being said time and time again, it's communication. And that is the key. And not that we necessarily know all the answers, but we should give the answers that we do know and say what we're working on and how they're going to progress, not just for the county, but for our partners from the Montgomery County Public Schools. And in that vein, I do believe we need to be clearer on how we're communicating. I had several people call and talk about the booster for their child and say, the CDC says it's available. Well, the CDC didn't actually say it was available. It was that it's available, but then the next group has to look at it, and then an advisory group had to approve that, and then they finally. So I think we need to be very clear on the first page of our website, of the county website, to say this is where the process is. I know you heard this on one of the news channels, but this is where the process is. It's not available yet, or it is available, and how to go through it. We need to keep the message as simple as possible. And I know I'm coming near my few minutes, but I did want to mention that I do think we should not forget about our partners at Leisure World and Asbury and the villages of Rockville. If we could have a place where they could very conveniently pick up the rapid test so that they could get them easier, I think that would be something that we should put on our wish list as quickly as we can. And with that, Mr. President, I'm going to turn it back over because I know I'm at 5 minutes. Thank you very much.
Thank you, Councilmember Katz. Next, we have Councilmember Navarro, followed by Councilmember Jawanda.
Thank you, Mr. President. And I join my colleagues in expressing my concerns and all the prayers to Councilmember Rice's family. We know that they're strong women, so we will keep praying for healing. I wanted to bring up, I guess, a different angle, and I appreciate all of the conversation and the questions, et cetera, as well as all the efforts. I mean, this has been extraordinary. Here we were about a week ago talking about the lack of available tests, and luckily, things were able to open up and things are starting to be distributed. I think it's important. So I want to keep on this question or this notion of messaging, and obviously recognizing that this is a very different wave, and recognizing that one of the interesting elements of this particular wave is the issue of how it has affected staffing and therefore how that affects services, not just within our county government, but as we also have, of course, been tracking and listening to parents and concerned folks in the school system, the issue of the expectations, because if students are going to be in school and there are so many staff that have been affected by the virus, we know the instruction is not going to be the same. And level setting that expectation, I think, has been, in my opinion, something that it's new, right? We've been so focused on the messaging around being vaccinated and testing, et cetera. But this particular wave, in my opinion, of course, has been so different. Can you talk a little bit about how you're doing that? I know that you've done some work around, for example, the shortages with firefighters, et cetera, but, in your conversations, in your meetings, in your strategy setting, how is that being factored in, and how can we all work together to be sure to set the stage for our residents to understand that, yes, there is absolutely an impact here that is different than other times, and we all are going to have to be patient and recognize that it is real. And then also the piece around how long do you think that these staff shortages, of course, will probably last in terms of tying that to the duration of this wave?
So, Councilmember Navarro, I'll start, and I'm sure Dr. Kroll and Dr. Stoddard and Mr. O'Donnell will weigh in. So we've taken all those considerations that you eloquently articulated this morning. We're looking at those conventional, those crises management, those contingency operations using the CDC guidance. We know that there's no clear-cut guidance right now. That's absolute. We are taking every case, every situation independently to look at not only our workforce needs and challenges, but those school-related challenges as well. As we continuously have conversations with our medical experts, our public health team. We look at the guidance. We know that there have been some questions about the CDC guidance and the need to return folks to the workplace if they've tested positive. We also looked at the American Medical Association and their concerns, which indicated that 30% of those positive individuals and or cases may still be symptomatic and returning to work. And so we're taking all of those metrics into place. We're working with our hospital systems to look at those real-time needs based on their infectious disease units and their occupational care units. So we're looking at all of these metrics, working with our community partners. We know that testing is paramount now. We need to identify those who are infectious. This Omicron surge the variant is highly transmissible. And we're taking all of those factors into consideration at a community level and at an individual level as well. And we're having those conversations. We know that there is no one best fit scenario that can be a universal fit. So we're taking all of those into consideration and we're making those practical assessments. We're also doing modeling to make sure that we look at those national trends, those state trends, and those county trends so that we can get a better estimate on where we see those surge, where it will peak, where it will not, whether it will be a instant decline, a gradual decline based on our vaccination rates. We know I came into the conversation, I think, at the end when Dr. Kroll indicated that, we're looking at multiple factors and we're looking at testing and vaccination. And we know that those are key preventative measures to mitigate or suppress the transmission of this highly virulent variant.
I'm going to take Dr. Cole, if you want to go ahead, I do want to.
I was just going to say a couple of things. One was just to acknowledge the conversation that took place earlier about hospitals and the experience of hospitals. The numbers don't tell the full story because the numbers look like we have sufficient beds, but we have staff in the hospitals who are out with COVID now and who are at home and can't get into work for a variety of different reasons, and that changes the calculus about how hospitals manage. So, and I think that's a message that hasn't fully gotten out in a way that perhaps this will begin to help do that. The other piece of this is that would argue that we are working continuously with MCPS and to talk about how we message to the community about the impact of COVID on the staffing of the schools and the ability to provide in-class instruction and in-person instruction in a safe way. And I think that it's theirs to message, but certainly we are working with them to try to make sure that they're clear about what it is that they need to message to the public in relation to the virus. And then I think the last one, I'll turn it back over to Dr. Stoddard, because I think there are fire and rescue and police and other areas where messaging is taking place that he's been a better place to talk about.
Yeah, I think that we've got to communicate this more, because what I've seen a lot on social media in commentary, not just from parents, but for all kinds of services being accessed, is this perception that we're in the same kind of situation we were in 6 months ago. What I mean by that is when we had a deficit in a particular area before, okay, let's backfill it with this other thing that we had that's maybe not active or something along those lines. That is not the situation we are in right now. And I think we need to be very clear that we would love to do more. There's always a request to do more of this, more testing, more contact tracing, more whatever service. The school system with the bus drivers. We've had to take kids to school, drive them as well. I understand that. I realize it's easy for me to do. It is far more difficult for many, many other families. I totally appreciate that. And I understand how debilitating that is to the ability of those children to get educated. But to expect that every institution can just cover up or paper over massive staff shortages one area, when all the staff shortages are being experienced across the entire system. And so I think we just have to be a little bit compassionate about just sort of there are massive impacts going to be felt by Omicron. There is no papering over those. There's no band-aiding them with one service into another. There's some triage that's going on to figure out exactly what we can stop doing to be able to support something that's an important service. But we are going to have a very tough next 3 to 4 weeks minimally. I think that's sort of what we're expecting. And there will be no covering up. We can cover up some of the worst of the issues, but there will be no, we're asking the National Guard to provide bus drivers. I want to let that sink in for people. That is not something we would do under normal circumstances. These are not normal times, and to expect that we or Ride On or or the school system are going to be able to paper over some of these issues is just an unfair expectation to have. Whether it's the public sector, their private sector businesses closing for similar reasons. It is unfortunate. It is going to be painful for us and for residents, but it's just a reality of the situation we are in right now. Something like, Dr. Scott Gottlieb, who is not a, liberal pundit, he's a former FDA commissioner under the Trump administration, has said he expects 30 to 40% of the population to be infected with Omicron for this wave. We are seeing a significant level of infection. I think it's just so important that people understand that there will be no band-aiding some of these losses, and there's going to be pain felt. And I don't think we're trying to avert the worst of those pains, but there will be pain felt.
Empty shelves in supermarkets due partly to the staff shortages as well. And so I appreciate that, Dr. Stoddard. I believe firmly that we have to be absolutely realistic in our messaging because there's, as you said, no way to sugarcoat this. The last wave, we were worried about the infection, we didn't have the availability of vaccines, and that's why everything kind of shut down for a while, et cetera. The idea was to protect people. Now everybody has been out, et cetera, and folks are being infected, and it is causing folks to have to stay home, of course. And so this notion, almost this fantasy that somehow we just need to solve our so-called philosophical differences and everything will be, done. It is absolutely impossible. There is no way that we will be able to provide those level of services as folks expect. And we need to be able to, in my opinion, be more forthright in our communication about that, so that as we're going through this very painful period, which hopefully will, only last 3-4 weeks more, keep our fingers crossed, that everybody understands, yes, we're frustrated, but it's also a reality. The bodies are not there. The teachers are not there. The staffing is just not there. And therefore, we all have to come together and work through this. So I implore, especially our communications folks, to begin to work strategically on this kind of messaging as soon as possible. And let us all amplify that as well. Thank you so much.
Councilmember, thank you. It is, we don't talk a lot about the staff in this process in some ways. And having just gotten notice of 2 more resignations from the department this morning, along with the 100+ people who are out with COVID right now in the department. Folks are tired, folks are exhausted, and in some cases, folks have given up. And we've got a lot of folks who haven't given up and who are still standing strong and standing tall, but they are tired. So the message around patience and understanding that what is affecting the public is affecting the staff, and we don't have bodies standing in the way that we can move from one place to another place. This is now going to be tough for the next month, and we will get through it, but it's going to take some time. So I appreciate your thoughtfulness in the words.
Thank you. And in closing, I would be remiss if I didn't give a shout out to the folks working at the Civic Building. I went to get a PCR test last Friday, and I was so extraordinarily moved by their sense of duty, professionalism. There were a lot of bilingual staff there, and so I was watching how they were serving everyone, and it was just extraordinary. So have to give a shout out because folks are still there doing their work, being exposed, but doing their work with full hearts. So thank you.
Thank you, Councilmember Novato. Councilmember Jawando, and then after Councilmember Jawando's questions and comments, we will formally introduce the public health order at the request of the county executive and engage in a Q&A with our colleagues in the executive branch.
Thank you, Mr. President. You're running a tight ship. It'll be done by 11. This is great. And good morning to everybody. Thank you as always. I have a little list here so I can stay on time. The libraries, I'm lead for libraries. It was such a joy to be at Praisner, and I swung by only to help pass out some of these test kits. To Councilmember Navarro's point, we could all look where we were a week ago. People were pulling their hair out, freaking out. We didn't have any tests. And I got a message at 12:11 a.m. this morning from someone I don't know who just said, grateful for the tests I was able to pick up for my family today. The line was with a lot of O's long, but it went really fast and was easy. Thank you to the council and all your staff in the county. I think we just have to remember that we are all working very hard in responding as quickly as possible. And I think yesterday was a great example that we are doing what we can. And it didn't just happen. The test didn't just get there. Dr. Stoddard and the executive branch, they were ordered months ago. Work had happened and it didn't come when we wanted, but we got it up and running. And I just want to kudos. It reminded me why I'm happy to be serving here in Montgomery County, and to all the people who physically did it. Thank you. I gave out a few hundred, but 93,000, that's a great number in one day. To the MCPS frustrations, and I start with that because I kind of feel like we need the old London sign, stay calm and carry on. I mean, we've got to remember that this is extremely difficult. Every teacher, every educator, every bus driver, when I put my kids on the bus this morning, everyone wants our kids to learn and to be safe and to be healthy. Everyone wants that from every side of this debate. We all want that. No one's trying not to achieve that. And but it's hard because we've never dealt with anything like this. These staff shortages are real. People are stressed out. The sermon in my church this weekend was that we're running on empty. The gas tank is empty. And how are we going? It doesn't feel like a new year. We're just continuing. It's Groundhog Day, and the tank's still empty. And so many of our folks feel that way. And so, to your point, Dr. Starter, my question and expectation setting is, I want to ask, based on what we are looking at with the spread, those numbers you talked about, 40-50%, and the staff shortages we're seeing. And I know the MCPS isn't here, but in your opinion, and anyone can address this, are we going to have to consider going to virtual schooling at some point because of the range of these concerns? Realizing no one wants that. I want my kids in school. We know that it disproportionately impacts certain communities, but where we are, just realistically, is that going to be something that we're going to have to deal with over the next several weeks?
I don't know. I'm sure everyone's going to want to comment on this. What I expect is our strong preference to keep kids in the classroom to the extent possible. Now, I will tell you that I would expect that there are going to be more than just these 11 who have to convert because of the staffing issues largely driving them. Now, there's been a lot of commentary that there's massive transmission going on in our schools. What I don't actually think that's actually what's happening. I think we're detecting community transmission that's occurring in the community when the students and faculty are reporting to school or through the tests that we're providing them via the school. But I mean, I'm sure that there is there are cases where school transmission has happened. I'm sure that it does happen. I'm not denying any of that, but I think to be realistic, I think we prefer not to make a system-wide decision.
Sure.
But the staffing issues could certainly get us to a point where more schools, and even under some extreme circumstances, it could become necessary. What we've largely said is, as long as schools are incredibly no greater risk than the community, but that also includes supervision by adults who are teachers and provision of education, then we're going to try and keep them open. But obviously there are limits to that.
Before you chime in, Doc, and I do want to allow this, I just want to make this point. You're bringing up there's a lot of factors to consider. I've been in talks with the MCPS superintendent and the general counsel about this opt-out, opt-in. If we could test more people in school, we can use a scalpel as opposed to a broad policy and shutting down the whole system. So that's a thing the governor and the director of health has to give us the ability to do, and we're working on that. But you bring up a good point that staffing shortages, all this plays together. And obviously we want to scalpel, but we have to recognize where we are. Dr. Kroll, and then I'll turn back.
So I would just add that what we are seeing, this whole process began during the winter break, when MCPS asked staff, parents to voluntarily send in their information about what was happening with their children during the break. And we got to those numbers that you all saw at the start of the school year during the break, but not in-school transmission. Having been back in school for several days in the week, we are seeing that there's some uptick in the number of positive cases, but that it's partial data and it's incomplete. What we are doing is using the system that we were using before, plus I think rapid testing adds a new variable, a new way for us to track that and to manage those cases. The big issue, as Dr. Stoddard points out, is does the school have the staff and the capacity to get students safely to and from schools and to educate them and keep them safe and socially distant while they're in schools.
And school health too.
And school health, yes, and our school health. Let me not forget that our school health staff are also being affected by this in terms of their capacity.
We just need to be honest with people why we make the decisions we're making. Yes. And if it's staffing, if it's this, we just need to no sugarcoat, no chaser, as they used to say. Just tell people exactly what's happening, and I think people will understand that we're dealing with difficulty. But I've
had a couple of conversations, and we'll have some more conversations with joint conversations with MCPS around that and around messaging. I think the messaging is hopefully getting clearer. You're right, straight no chaser. We need to let people know what the story is and why we're making the recommendations we're making, and why MCPS is making decisions about whether or not they close classes within schools, close whole schools, and hopefully not, but close the whole system down. I don't think we're there yet. We have some other things that we can do to help support in-person learning, and we want to try to keep that going as well as best we can.
And the only point that I will add is that we're looking at other models. We spend an enormous amount of time looking at New York. And New York use a surveillance data approach. So as Dr. Stoddard and Dr. Kroll indicated, there are other metrics that we're looking at. that they articulated that due to interest of time, I won't go in, but we will be transparent and look at the data analysis and share that data, because we know that most of the outbreaks that are occurring are community level versus school level.
Yeah. Thank you, Mr. President.
All right, thank you all so much. I'll remind my colleagues, our friends and MCPS will be joining us on the 18th, and they are having their own town hall on Wednesday, which I know Dr. Bridgers will be participating in, and that will be another opportunity for the community to be heard and for hopefully a dialogue to ensue, because that is obviously a critical issue and has so much fallout. I was talking to somebody the other day, the pickup and drop off at schools, because buses aren't available, have become immensely challenging, and so there are so much fallout as a result of this. So I appreciate everyone's comments.